This is me Gayatri Prakash and welcome to my page. എല്ലാവർക്കും എൻ്റെ പേജിലോട്ട് സ്വാഗതം. So today me and Shagun is here to discuss with you all about bedwetting, OET speaking. Do you all remember the last exam they have asked regarding the bedwetting? Am I right? So here me and Shagun would like to discuss with you all and to clarify your doubts and how to proceed with the bedwetting topic. So let's move on to the topic. I'm playing a nurse role.
And my name is Shagun and I'm playing the mother's role.
Okay, then. So here, what is the topic? The scenario is Shagun is playing a mother's role. Her name is Maria. So she has a son. Her son name is Bob, who is 4 years old and who is having a complaint of bedwetting for the last 2 weeks. So Maria is so upset and she annoyed with Bob. That's why she came to the community center to me, discuss with the problem of Bob, and she wants to get the solution, and also she wants to overcome this bedwetting problem of Bob. So let's start the topic. Okay. Hi Maria.
Hi.
My name is Gayatri Prakash and I am a registered nurse in this community health center. So I can see that you are somewhat looks anxious and upset and something is bothering also, and I can see you brought your son Bob along with you. So Maria, could you please tell me how can I help you today?
Yes, nurse. I'm here with my son at first, Bob, and it's very annoys me. Like he's wetting the bed a lot, and it's disturb me a lot, and also upsetting him.
Well, Maria, I can really understand being a mother how pretty much you are worrying about your son's bedwetting, isn't it?
Yes.
But don't worry about that, Maria. One thing I would like to say to you is it's a quite uncommon thing to happen for the children to make a bedwetting, okay? But there are effective strategies to cope up with the situation. But before entering into the situation and the factors, here I would like to collect few information regarding Bob. Is that okay for you, Maria?
Yes, that's perfectly fine.
Well, Maria, could you please tell me how often Bob is wetting the bed?
Well, during the night time, nurse, he is oftenly wetting the bed in the night, but the daytime is normal.
Well, that's fine. So for how many days or how many weeks that he is having this bedwetting problem?
I can say for last 2 weeks maybe.
Okay, fine. So first of all, Maria, I would like to say here there are many factors which is includes in this bedwetting. One is it could be the hereditary problem. For example, one of your family members, for example, Bob's father, he might had a problem of bedwetting during his childhood, which means that might be continuing to Bob also. And the second factor is a medical condition. If Bob is having kind of a diabetes or kidney infections, that also may cause bedwetting. And the third factors are, it's a normal factors that I will explain to you later. So could you please tell me that do you have any family history of bedwetting, or do you have any medical condition which is related to diabetes and kidney infection to Bob?
Well, I can say there's no any hereditary problem in my family as well as his father's family, and
Okay.
Bob has no any other medical history like diabetes and kidney infection.
Well, okay, Maria. And another things, like as I told you, there are other factors also. The factor number one is like deep sleeping. When Bob is deep sleep, in that situation, they really unknowingly they are voiding and they really unaware about that. And second factor is the constipation. Because of the constipation, the bladder is compressed too much. So because of that, the baby is voiding unknowingly. And the third factor is it's a hormonal factor. Due to the hormonal problem, they used to void a large amount of the urine during the night time. And the fourth factor is the structural factor, which means when the bladder is so small, because of the 4 years old baby usually have a small bladder. So the small bladder, when filled with over volume of the urine, that may also end up with bedwetting. So from this, any of the factors only your Bob has having suffering with this bedwetting. So do you have any idea about it?
I think Bob have constipation for last 2 weeks.
Okay, so that could be the reason also, Maria. So you have to look after that. And do you have any more concerns regarding that?
No, nurse, but I really need to know how to overcome this bedwetting It's really upset me.
Well, Maria, being a mother, I know really it is upsetting you a lot, especially Bob also, and you are getting angry and it is really giving you more work. But don't worry about that, Maria. As I told you, there are effective strategies to overcome the situation. And let me explain to you one by one. Is that okay for you?
Yes, nurse, please.
Well, first of all, the first main factor is proper toilet training, Maria. It is a very good thing, and also training him in a proper way and explain to him before go to bed. He has to go to the toilet and empty the bladder completely and go to the bed. So that will help him to avoid bedwetting. Okay. And the factor number 2, we can say to Bob, like try to avoid soft drinks and chocolate drinks, and he can avoid caffeines and a large amount of fluid oral intake 2 hours prior to the bed, because if he filled with the more amount of the water, that may always end up with the bedwetting. Okay. And the third measures is like you can just spread the plastic matters over the bed, so thereby it is really helping you to not to washing the bed sheets or bedspreads every day, which is really causing you which is really annoying you every day more and more. I could really understand. So that will be the good idea to prevent the bedwet. And another factor is like, usually we can use the diapers before he go to the bed, and that also can help him. So by doing this, all those things. And the last one factor I can tell you is like, even though Bob before going to the toilet, you can set an alarm. So as per the alarm, you can wake him up in between the sleep and you can send him to the toilet. So by this way, step by step and gradually, we will able to control his bedwetting. So do you think you can do that, Maria?
Yes, I can do that.
Well, Maria, I'm really glad to hear about that. I hope I have clarified all your doubts so far, and my suggestions will surely help you to control bedwetting of Bob. And if you have any suggestions, any queries, please do not hesitate to come to me again, and I'm here to help you out.
Okay, nurse, I will be here if I have any questions.
Well, Maria, also I would like to give you a pamphlet which is regarding the bedwetting and how to overcome the bedwetting problems for the young children. So just have a look on it, and if you have any queries, you can ask me. Okay?
Okay, nurse, thank you.
Yes, thank you for your visiting, and have a good day, Maria.
Okay, thank you.
Well, guys, I hope that our role play might be helping you all to know more about bedwetting, because this has been asked very recent exam in August 6th. So just have a look on it and practice yourself. Though we did not do it in a professional way, just we want to deliver the points, how to make a role play and what all the points where importantly we can talk to the examiner, and how to tackle the situations, and what all the important points like we can add it in the bedwetting. So hopefully this video will helpful for all, and whomever is preparing for their exam, just watch the role play. This is really helpful for you. And whomever wants to join in my class, you can contact us at any time, because our number has given in our description. We have a 40 days, 60 days, and we have a 30 days mock batch, and all the classes are available. It's only online classes. So contact us and join in our class.